My name is Victoria Diez and we're going to do video number 1 for my client assessment class. We're going to examine the skin, the head, the neck, and the eyes. To begin with, we're going to start with the hair. We're going to look for the evenness of the scalp. It should not be any empty patches, so missing hair. It should be no irritation on the scalp. It should be clean, and it should not have any type of scabs or anything like dandruff looking at. The second thing we're going to look is going to be the head. First, we're going to look for symmetry of the structures, for the bones of the cranium, of the facial bones on the sides, the nose as well. The eyebrows should be even too, as well as the eyes. The next thing we're going to look at is the neck, because it's the one that follows from the head to toe assessment that we're doing. On the neck, we're going to look for any signs that it should be any bulging of the veins or the arteries. The skin should be intact, as well as in the rest of the places. We're going to talk about it when we look at the skin. We're going to palpate as well for the tenderness of the lymphoid nodes, if is there any pain or any discomfort upon the palpation. We are also going to assess for the carotid artery. We're going to listen for a bruit that it should not be present if it's a person who doesn't have any cardiac disease. Following this, we're going to assess the eyes. Then for the eyes, we're going to look for no discharge on the part of the inner canthus towards the outer side from both sides. We can also inspect by doing this, and then the person will look down, and then you tell them to look up, and then it should be on a pink side on the conjunctiva. You do both, you assess both eyes at the same time. For the eyes as well, we're going to look that they're clean, there's no discharge, and you can also palpate from the inner canthus and do some pressure in it, and ask if the person has any tenderness. You can also assess the peripheral vision with the pen light, and just have the person cover one eye with one of the hands, and then you're going to ask them if they look at the object and when they start seeing it, okay? So when you start looking at the pen light, you tell me.
No.
So at this point, it should be normal around the same symmetrical line of the body. You can also check for the pupil responses, and the environment should be a little darker. You can cover the person's eye and just look from the outer part with the pen light inside for the pupil response, and it should be very brisk and very rapid. You do the same for the next eye, and it should be very brisk as well. If the pupil responses are very sluggish, it can be any cranial dysfunction, cranial nerve dysfunction. For the skin, we're going to look for the intactness of the skin. It should be an uneven color, no open sores, no any scabs, any irritation. The color should be even all over. If there's any redness, that's a normal sign that you're going to look for. It shouldn't have any excessive dryness. It should be all even, and the person should be able to tell you if there's any itchiness or any open sores that might be on stages of healing. For example, if they are, let's say she has one here, you look for that the stage of healing should be on a normal tat. It shouldn't be any longer than 2 weeks, and sores that heal longer than 2 weeks should be examined more closely. We're gonna go back to the neck just to mention that when you're palpating for the lymphoid nodes, you can also palpate for the thyroid. You can do it both ways. You can do it from posterior approach, or you can do it from an anterior approach. If you're going to do an anterior approach, you're going to palpate with both of your thumbs, and you're going to do this little motion and no pressure not doing a lot of pressure into it. If you're going to do it from the posterior, you're going to go from behind, and you're going to use those 4 fingers and just palpate this way. If you're going to be a long way very parallel to the cricoid bone, and it's going to be just in the middle. And also for the eyes, you can assess for the movement of the eye. Like if you have the pen light, you hold it out and you tell the person to look up and look down and look to the sides, and it should be all 180 movement and also a 360 degree movement. Or you have completed the assessment for skin, hair, eyes and head.